Hi, I'm Dr. Stevens, and here with John Bridges today. And so, John, today we've got a patient, and we're just going to kind of talk a little bit about what to do. So, it's a 67-year-old gentleman who presents today. He was seen in the emergency room last week. He's had a history of atrial fibrillation, and is concerned today because his wife told him he needed to come in and stop drinking coffee. And there's a new study that just came out. As a coffee drinker, kind of important for me because I think I'd be really concerned if my wife told me I had to give up coffee.
Exactly. That study was kind of interesting. The study did show that coffee may not be as bad for you if you have AFib as people think.
And what was really interesting was, like, not only do they say that 1 cup of coffee doesn't make it worse,
It kind of fared better.
yeah, they have fewer
episodes of AFib.
And so it may actually be good for us to drink a cup of coffee. I think one of the interesting things that came out with as the authors were talking were not just, we always worry about the caffeine, and certainly too much caffeine is bad for us. Coffee's got a lot of other things in it that are really good for you. Right?
Mm-hmm.
It's just full of these antioxidants, and just a lot of studies have shown, not just for AFib, but for people who drink coffee tend to live longer.
Mm-hmm.
And so that's always been a worry. Well, maybe it causes heart arrhythmia, but the study didn't really show it.
Yeah, it didn't, and I guess it's just all of how severe your AFib is. If it's a fairly new onset, or if someone has had it for a long time, it may not
Affect it as much.
Not affect them as much. And according to how their body is affected by caffeine in general.
Person in particular that I would say is, I think a cup of coffee every day is fine, but I would probably counsel that person not to have alcohol. Certainly we know that alcohol in this setting could certainly trigger AFib. Years ago in residency, we'd have to work, New Year's Eve, 4th of July. We used to call it holiday heart because people who hadn't had a drink all year would have something to drink, and invariably we'd have 1 or 2 people every New Year's Eve, every 4th of July come in new onset atrial fibrillation, and to the point that we called it holiday heart, right? That we knew on some of those occasions where people would maybe have a drink of alcohol where they didn't before, they were more likely to have AFib. And certainly if he is already set up for that, I'd probably say probably better to avoid that. But having a cup of coffee every day may be beneficial. The other thing, of course, with coffee that and different people have different opinions on what should go into coffee.
Right.
And
some people may want to put that holiday drink in there with their coffee.
Have an Irish coffee.
That's right.
We have to be careful of, but also just too much sugar.
Too much sugar. Yeah.
Right. And being careful of the creamers, having too much creamer. There's questions, a lot of people would have various questions about how much milk to put in it. Personally, I love myself a good flat white or good latte, but then also watching that you're not getting too much saturated fat, too much sugar with a lot of the syrups and things that you put in them.
Yeah. Things that make coffee worth drinking.
Yeah, so for some people, see, I just love a good cup of black coffee, which my wife says I'm crazy for because she wants hers to be a little bit sweeter. So I just dip my finger in and I swirl it around.
That makes it sweet enough.
She pours it out the drain when I do that. But, sorry. Hey. But yeah, I think for this guy, we at least have some good news. A cup of coffee.
He's safe.
Make him live longer, and go to the ER less.
Exactly. Take away from this is everything in moderation.
Moderation, I think, is a good key here because certainly you can overdo the coffee and have other problems with it.
Like everything else, that's right. So and done in moderation, it should be good for you.
That sounds great. Well, I think we got our plan for the patient.
Yep.
All right. Thank you, John.
All right. Thank you, sir.